Welcome to the deep dive. Today we're looking at some really crucial demographic news coming out of India. Essential stuff if you're studying current affairs or demography. The sample registration system, the SRS, their statistical report for 2023 is out. And the big headline, India's total fertility rate, the TFR, has dropped to 1.9.
That 1.9 figure,
Yeah,
it's a big
down.
one because it officially puts India below the replacement level fertility.
Okay, maybe we should quickly define some terms for, learners tuning in. TFR first.
Right. So total fertility rate, or TFR, that's basically the average number of children a woman is expected to have over her lifetime. Simple as that.
And the replacement level you mentioned?
Yeah.
Yeah.
That's the TFR needed for a population to, well, replace itself from one generation to the next without migration. It's typically around 2.1 children per woman.
Got it. And this data comes from the SRS.
Exactly. The sample registration system is a huge demographic survey run by the Registrar General's office. Gives us these reliable annual figures for fertility, mortality, all that key data.
So this national TFR dipping to 1.9, it's more than just a number, right? It signals some fundamental shifts.
Oh, absolutely. And it's not just TFR. The report also shows the crude birth rate, that's the number of live births per 1,000 people in a year, has also fallen.
What were those numbers again?
It went from 19.1 in 2022 down to 18.4 in 2023. So a clear downward trend there, too.
And this isn't just happening in the cities, is it?
No, and that's maybe one of the most significant findings this time around. For the first time ever, the TFR in rural India has hit that critical 2.1 level.
Wow. Okay, so it's a widespread shift.
Definitely. It suggests the factors driving down fertility are now pretty pervasive across the country.
But it's not uniform, is it? I mean, the state-level differences seem huge.
Oh, massively different. You've still got states well above that 2.1 mark. Think Bihar at 2.8, UP at 2.6, Madhya Pradesh 2.4.
Rajasthan 2.3, Chhattisgarh 2.2.
Exactly. But then you flip to the other end of the scale, Delhi is way down at 1.2.
1.2. And West Bengal, Tamil Nadu, both at 1.3, Maharashtra 1.4. It's like different countries almost, demographically speaking.
It really highlights the uneven nature of this transition. And another point the report makes is about the aging population.
Right. More people over 60.
Yeah, the proportion is rising. Kerala actually has the highest proportion of elderly folks now. That's another consequence of falling TFR and, longer lifespans.
Okay, so this whole picture, falling TFR, aging population, it sounds like a real double-edged sword. Opportunities and challenges.
That's a good way to put it. Let's maybe start with the positives, the opportunities.
Sure. So lower fertility. Good news for development.
In many ways, yes. It's often a strong sign that development policies are working. Things like better female literacy, more girls staying in school longer, women joining the workforce.
Increased access to healthcare, maybe later marriages too.
Precisely. All these factors tend to correlate with women choosing to have fewer children. It signals socio-economic progress.
And it helps with population stabilization, I guess. Less pressure on resources, infrastructure, the environment.
Definitely a long-term benefit. It can ease the strain on public services and potentially allow the government to focus more on the quality of services, not just quantity.
Any economic upsides?
Potentially, yes. With fewer children, families might save and invest more. That could, give a boost to economic growth down the line.
Okay, so those are some clear positives, but you mentioned challenges. Let's get into those.
Right. The biggest one, perhaps, is the demographic dividend. India's had this potential advantage of a large, young, working-age population.
But fewer births mean fewer young people entering the workforce eventually.
Exactly. That window of opportunity, the demographic dividend, isn't infinite. It's closing. We urgently need policies to skill up the current young population and create jobs for them now.
Before that bulge moves into old age.
Precisely. Which brings us to the aging population issue. Lower TFR plus people living longer means a growing proportion of elderly citizens.
Which means more pressure on pensions, healthcare.
Huge pressure. Rising healthcare costs, the need for geriatric care. We need infrastructure and systems that just aren't fully there yet. We see this playing out in places like Japan already.
And potentially labor shortages, too, if the workforce shrinks.
A definite long-term risk.
Yeah.
Fewer workers could really impact economic productivity across various sectors.
And going back to those state differences, Bihar at 2.8, Delhi at 1.2, that creates its own problems, doesn't it?
Absolutely. These regional imbalances are significant. Think about interstate migration patterns, how resources get allocated between states.
Even political representation, like deciding parliamentary seats based on population.
That's a big one, yeah. Delimitation becomes much more contentious when demographic trajectories are so different across states. It can really exacerbate tensions.
So summing up, India hitting a TFR below replacement level is, well, it's a major milestone.
The huge socioeconomic turning point, really,
Yeah.
reflects progress but throws up some serious challenges for policymakers.
It really requires some careful thought moving forward.
Indeed, it's not a simple picture.
Which leads to a final thought for you, our listeners, to chew on. How can India's policymakers manage this split reality? On one hand, you need to harness the remaining demographic dividend in the higher TFR states, places like UP, Bihar. But simultaneously, you need to prepare for aging populations and potential worker shortages in states like Kerala, Tamil Nadu, or Delhi. It's not a one-size-fits-all problem, is it? It demands really smart, targeted, and proactive policies across the board.